Hey everybody, it's Matt and Dyan. Welcome back to OK Aussie. It is Saturday, 11th of October, 8:49 PM, and Dyan has just said she's not feeling all that well, which is really an indication that she's starting to go a bit offline and feeling a bit uncomfortable, which we could have something neurological going on. So, just going to put some pulse oximeter on, see what's happening, get a bit of an indication, and see what we need to do to help her. Alright, sweetie. Has some sort of awareness, unable to communicate, probably focal seizure, I say was an early indication to what's happening. Sense of confusion. Alright, let's just get this up and going. Oxygen stats are 96, heart rate is 72. Let's get some alerts up so we can actually see. Hey Maxie. How are you feeling, dude? Unable to communicate. Looks like there's a bit of mandibular stuff happening. So let's just quickly make the environment a little bit on the safer side of things. Alright. We will get you through and we'll work out what's happening. Go down flat, sausage dog out the way, remote control out the way. Do you have any nausea? Able to communicate. Okay. That's what else is happening. Oxygen stats are 95, heart rate is 67. Hey, sweetie. I'm right here. It's okay.
Yeah.
No worries. Okay, so we are a bit on the warm side. 38.1 degrees, obviously over febrile. Oxygen stats are just going down to 92%. Just make sure the audible alarms are up. What's happening, Kim? You don't know? Nor do I. That was very sudden. We were just watching some TikTok on TV. Thanks, honey, for helping. Appreciate that. I'm just going to do this over the top of this. Very lightweight pajama top that she's wearing. So she's very hot, so I need to get her some Panadol. Outside temperature is 16 degrees here in Perth. Inside temperature in the room is only 22.9. So she shouldn't be that hot. Oxygen stats are 96, heart rate is 66. Now, was just about to give her some of her favourite barbecue tangy crackers and some barbecue sauce, or actually the sweet burger sauce, but she just said, just on the instance of giving it to her, let's relax your arm, that she was suddenly, instantly feeling funny. Say 51 PM. Oxygen stats are flapping, it's about 93% right now. Blood pressure, okay, 103/70, heart rate 70. She's not able to communicate and engage. We've got some segmental cranial dystonia. I see the left jugular carotid artery is really pumping at the moment. 103/70, heart rate 70. Hey Maxie, another way, boo. Okay. So there were no indicators before any of this, unless, let me have a look, what have we had today? There has been some aphasia, some struggling with word finding particularly, some of the stuttering, slurring that we normally see post-ictal. We've got oromandibular happening right now, so part of segmental cranial dystonia. Blepharospasms affecting the eyebrows and the eyelid at the moment. Okay, just getting the oxygen in for this device, ready to go, in case we need to bring that up and operational. Let's see, supplementary oxygen. Oxygen saturation at 93%. If it hits 90% in the alarm, I'll put oxygen on her at that stage. My girl. 8:54. Now Dyan has had seizure 8:52. Oh, come on, kid. What's going on with this today? Wasn't expecting this right now. Okay. Full upper body contractions to torsos, rounding of the shoulders coming forward. Outward turn of the arm. Both feet are inward turn and flexed. Highly contraction at the moment, a lot of pressure coming through the neck. As you can see the arms, so we've got tonic-clonic seizure. Hey Google, start timer, 10 minutes. 10 minutes. Okay. Okay. Alright. We've got this, boo. It's alright. Alright. It's okay. Tonic-clonic seizures continuing. We started the timer on Google Home, just so that I've got a reference point as when the tonic-clonic seizure has started. Just obviously with the difficulty in the breathing, just making sure for aspiration that we're not getting any fluid back into the lungs. Good girl. It's alright, this will pass. Hair out of the way. Good girl. It's okay. That's okay. That's post seizure. Let's come back over here. Alright, let's work out what's happening. So, blood pressure, okay. Oxygen stats have been dropping. Currently at 96, heart rate's just at our peak. And then it's just fallen back out again. So we've had a bit of an up. So during the seizure, increase in the heart rate as expected with tonic-clonic seizures by about 20, 30 points. And then it's just dropping back down again. Dyan feels very warm. And at 38.1, obviously febrile temperature, she is warm. Hey Maxie. It's alright, sweetie. Dyan's face is indicating that we've still got blepharospasms, a lot of oromandibular, left jaw thrust activity. Just getting some midazolam out ready. It's alright, kiddo. See the toes, you can see the hand. Yeah, you can see what's going on in the face just down here. It's alright, Bubba. It's alright. A lot of tension in the right glenohumeral. The whole trapezius deltoid is pushing right upward at the moment. It's alright. With the head rotation, that's part of an axial tilt or axial rotation of dystonia. So she's got dystonia plus tonic-clonic seizures. Oxygen stats are 96%, and heart rate is at 77 beats at the moment. Syncope 8:56. Hey kitten. It's alright, I'm right here. So's Maxie. Willow's in the background. I know you can't communicate, can you? It's alright. It feels funny because the... Okay. Yeah, I know. You've got these spasms around your left carotid artery. You can see the continuation of this. So the engagement is just down this left. You can see she was pointing to the left carotid when she had some sort of recovery point in the middle. So she's going in and out of this at the moment. It's alright, it's 8:56. Full tonic-clonic seizure. Hello, boo-boo. It's okay. Now I'm on. Get up there. So we're getting multiple tonic-clonics in this set. Looks like we're going for them DAS. Maybe a little bit earlier than anticipated. Oxygen stats 96, heart rates accelerated 85. Sorry, kid. Try and oxygenate, a lot of rapid breathing, nasal flaring, just trying to get some oxygen in. Hello. Hello. All right. I'm calling it, my dad's, we're doing now. Hey Google, set timer, 10 minutes.
Okay, for how long?
10 minutes.
Second timer. 10 minutes.
Okay, midazolam 5 milligrams per mil, 858 applied orally buccal. We should have within 10 minutes a recovery of tonic-clonic seizures. Then we can also have the opportunity to put some muscle relaxants in there with clonazepam. So right up. I'm right here. Oxygen stats 97, heart rate 78. So,
Dyan, take your sleeping tablets.
so let's Google home automation with the reminder for Dyan to take sleeping tablets for the 9 o'clock routine, because it's just gone literally 9 o'clock. Now, she's already started the night routine from 5:25 this afternoon. So all normal medications have been applied for seizures. Night routine, so that's the sodium valproate during the course of the day. Remembering that Dyan has been running fevers for a couple of months straight. She's got a fever rampant, but also with that infections. Now, being febrile and also having infections, both of those are high likelihood exacerbators and triggers for going into seizures like this for patients with 22q, 11.2 deletion syndrome, the chromosomal genetic condition that Dyan has got. She has a microdeletion of the 22nd chromosome, where she's missing about 40 to 60 genes. And that means she's missing 3 million DNA building blocks, and it affects anywhere up to 185 clinical symptoms in a patient like this. It's alright, sweet pea. 8:59 p.m. It's alright. Now during this we can get mixed neurological activities. You've got dystonia going on, segmented cranial, axial tilt dystonia, focalized dystonia. You've had multiple sets of quite vigorous tonic-clonic seizures. You've got orthostatic intolerance where the heart rate has been really flapping around, and oxygen drops down to 92% saturation during this. There's still a lot of oromandibular and left jaw thrusting, a bit of bruxism going on with the grinding of the teeth at the moment. There's been some presyncope and syncope happening as well. This has been very rapid indications. A bit of asphyxiation can occur, particularly with oral medications and just the natural process of trying to swallow. Alright, Ken, you're not really doing too well, are you? I need you. I know. I get it. Just for drainage, let's just make sure you're doing okay. Alright, you're doing really well. Survival 1. So, the midazolam emergency medication, so it's an ASM, anti-seizure medication, has been applied orally. That normally within 10 minutes should actually cause a resolution to the tonic-clonic seizures. The other components, dystonia or Tourette's, motor tics, even vocalized tics that may occur around this time, will probably be more likely to help with clonazepam muscle relaxer, but I can't give that orally at the moment until she can have the ability to be cognizant and swallow, so that we don't choke on doing that. I don't have liquid medication in that format. We're trying to get hold of that, the clonazepam liquid, which will be at around when the doctor gets back. That's all right, Papa. Syncope still at the moment, so not enough oxygen flow to the brain causes the fainting passing out, which is syncope. And there's no indications of nausea beforehand, so quite commonly in the pre-ictal stage, Dyan would indicate that she might be feeling sick. There's been no head pain, so no migraines today. So that's been good. She's had good sleep last night, so that's been okay. The temperature, which can sometimes be a trigger for warmth from the environment, has also been very good. But she has been very PEM, post-exertional malaise. Hey, kitten. Yeah. Nick, that's one of the vocalized tics that occur. See the weird feet. And you can still see what's going on here. chorea, which is the rhythmical movement of the feet and legs, quite commonly happens with generalized dystonia. Just bring it up a little bit more. Right. Indications of chill, bringing on a blanket, turning off the fan. Obviously a bit of a rousing cognitively to know that she is that cold and able to communicate, at least by reach, not vocally or verbally, that there's an issue. You can still see motor tics that are occurring. Countdown timer, the first one is coming down to 10 seconds. That was when she first started doing the tonic-clonic seizures. So the indication of this, I'm just going to cancel this timer. Hey Google, stop. So that's when the first set of the seizures started. So we've been going for about 10 minutes. We haven't had any further tonic-clonic seizures, so a remind alert for that. The countdown here, the second one up the top here, is for the one I've given midazolam. The resolution of that, you can see the legs moving, like I said, that rhythmical cycling. Chorea, generalized dystonia is part of that. We're still seeing a lot of generalized dystonia in the face with blepharospasm. What's wrong? You feel sick, do you? Alright, let's go with some ondansetron. Let's get that into you. Placing into your mouth. Good girl. Alright, that will dissolve with sublingual wafer, so 4 mg of dansetron applied at 9:04. Motor tics is still occurring. Now, we've had subluxations and full dislocations of both left and right glenohumeral with shoulder joints, so I'm very concerned that we're going to actually cause some shoulder damage at this point in time. So there's some difficulties around being able to prevent that, obviously. Oh, sweet people. I need to give you a muscle relaxant, so let's get on to doing that part. I need to give you a clonazepam. I need you to swallow. I know you've got that one that's going to dissolve in 1 more minute. I'm going to apply. I'm going to get you sitting up and I'm going to do that. It's alright, I'm right here. It's alright. Oxygen stats are 96, heart rate is 74. Oh, kidding. It's currently 9:05 p.m. We have 2 minutes 51 left on that counter. That's the countdown timer for the midazolam that's been applied orally. Normally within 10 minutes the tonic-clonic seizure should be totally resolved. The indicators I'll look for there will be that it will give some very deep yawns, which are more about the relaxation as well as sucking in the oxygen. Quite commonly we'll see 3 or 4 very deep yawns, and that'll be the indication of the closure, the termination of the tonic-clonic seizure. So we started off with a focalized seizure at the very beginning. That went straight into some rapid tonic-clonic seizures. And we've also had some dystonia, which is the involuntary muscle contractions that are still happening. You can still see generalized dystonia affecting the leg flicking and tapping exercise. There's a lot of restlessness that goes with that, a lot of jerking. There's been motor tics that have been happening quite vigorously in this. So you've got a combination of Tourette's, which is motor tics, which is part of the Tourette's component, which is a neurodevelopmental condition. You've got the dystonia, which is another involuntary muscle contraction. That's affected from the basal ganglia. Dyan does have bilateral calcification of her basal ganglia, a condition known as Farr's disease, and that unfortunately affects the messaging and communication that's happening. Now, the medications that she's had through for the night preparation should not be enabling her to be like this. She's had all her seizure medication, relaxation, sleep medications, so she should be in a total state of restfulness, and being prepared, ready for sleep. But this has suddenly just jumped out at us and come on rapidly. You can still see the feet have been rhythmically moving. You felt sick, did you, sweetie? Starting to come around, aren't you? A bit more cognitively, which is really good. You can talk. It's 9:06 p.m. Countdown timer's got 1 minute 13 left on that for the Midaz indicators. And we're just about to lose the pillow. Don't want to do that. I'm just going to bring your head up.
Yes, please.
Yes, please. Right. Quick little check over here. 97% oxygen saturation. Heart's stabilised around 65 beats per minute. That food was for later. I need to give you... Okay, can we not play with that? Thank you. We're going to not play with the tea towel. We're going to place it there. I need to give you some Panadol. Alright, I'm going to give you some liquid. You're very, very high temperature. Okay, so I need to bring that down because you're cooking with gas, but without the gas, if that makes sense, yeah? See how your cheeks, they're a little bit red as well? Well, you can't, but they can. So you've got a malar facial rash. That's the butterfly-shaped rash on your face. Infections, neutropenia.
Maybe I got 2 infections.
Well, you got fevers at the moment, so we need to treat that. So I'm going to give you some liquid Remax. But before I do that, I need to give you some muscle relaxant. Sorry, but that's what I said we're going to do. Now, it's 6 seconds left on the countdown timer up here. That's for the MDAS. I don't see any more tonic-clonic seizures. Hey, Google, stop. So that concludes the seizure component. But you can see all these motor tics that are still going on. Yeah, very, very loud, miss. Right, first one in. We're going to give you that. Be nice.
I do it myself.
Good girl. Okay, you do it yourself.
You're so annoying.
I know I am.
You tip it wrong.
Okay.